Good afternoon, everyone. Thank you for coming and joining us today at this forum devoted to human rights in the time of COVID. I also, of course, want to wish all of you and your families and friends good health. I know that it is a very stressful time, but I hope the information provided today will be of some help. And I would also like to mention that cloud captioning is available. You, at least on my screen, you can go to the bottom, press on the closed caption button, and then you're free to increase or decrease the size of the font. I also want to thank all the wonderful sponsors who are co-sponsoring today's forum. And they are so many, I can't take up the next hour listing them, so they're listed on the flyer. However, we do have 7 excellent speakers, and I do want to take a few minutes to tell you the highlights of their work. So our first speaker is Nancy Haggins, and she has been a registered nurse for 31 years. She is a critical care certified nurse in the intensive care unit at Maimonides Hospital. Ms. Haggins is also the treasurer of the New York State Nurses Association, which currently has 43,000 members. She has been a strong advocate for nurses and for the communities they serve. Nancy Hagan has been on the front line during the COVID pandemic as Maimonides Hospital was hit very hard. Our second speaker will be the Reverend Karen Jackson. Karen Jackson serves as the Director of Recovery and Community Initiatives at Project Hospitality. She oversees 2 community help centers, which provide Staten Island community with information and help in getting benefits, health insurance, legal and immigration help, domestic violence intervention, tax-free preparation, and numerous other services. She is also the director of the Staten Island Long-Term Recovery Organization, which seeks an equitable long-term recovery from the pandemic. Our third speaker is Juan Fernandez. He is an associate human rights specialist at the Staten Island office of the New York City Commission on Human Rights. He has worked in tenant organizing, immigrant rights, workers' equality, and other human rights interests. Yasmine is a member of Teens Take Charge, which is a teen advocacy organization dedicated to developing teen leadership and improving the educational system. Our fifth speaker is Emily Prato. Emily is the legal coordinator at La Colmena. She advocates for the rights of immigrant workers and DACA recipients on Staten Island. As a recipient of DACA, she understands the importance of advocating for a pathway to citizenship. As a legal coordinator, she has conducted various workshops on DACA education and Know Your Rights. She has spearheaded the Staten Island youth group known as Staten Island Dreamers to train youth on how to organize and advocate for their immigrant community. She's currently on the dean's list in the New York City College of Technology, and in her very spare time, she is pursuing a career in law. Peter Kempner is the legal director at Volunteers of Legal Service. Previously, he was the director of the Veterans Justice Project and deputy director of the Veterans Justice Project at Brooklyn Legal Services, a legal service practice focusing on veterans, active duty military personnel, and their families. He is an adjunct professor at New York Law School. And finally, but not least, is Tanuja Mohapatra. She is the Director of Legislative Affairs and has been appointed Special Advisor for Strategic Initiatives to the Superintendent for the New York State Department of Financial Services. She will also continue in her role leading the Legislative Affairs team to help shape legislation on behalf of the department. She has also served as Chief of Staff and counselor to New York Assemblyman Nick Perry, where she focused on areas of home ownership rights and consumer protection for the underbanked and unbanked. These speakers will cover topics such as housing, working conditions, immigrant rights, food security, health care, education, and mortgage foreclosures. After the speakers have concluded their presentations, we're going to very happily take questions, and you can ask them by using the chat button at the bottom of your screen. Once again, everyone, please stay well. And Nancy, will you take over now?
Yes, thank you, and good afternoon. And I would like to welcome everyone today. And I have to say, can we just take a minute of silence to acknowledge and recognize those who have perished during this pandemic? So we'll just bear our head for a minute in memory of those we lost. Thank you. As a nurse last year, a year ago, when we found out we had the COVID-19, and at this time around last year, we probably had about 2 patients that had the COVID-19. And we thought it wasn't gonna be serious. So later on, by March, the hospital that I work with over 540 beds, we ended up being 100% COVID positive. And everyone had COVID. Initially, when the patients came in, we didn't know what to do because the country wasn't prepared, our healthcare management wasn't prepared, we didn't have enough PPE, we didn't know how to care for these patients because some of them would come in with a simple cold. The next thing you know, their lungs inflated, they go on a respirator. The next person will come as a patient with a cardiovascular. You would think the patient is having a heart attack. Give you an example. One patient we saw, we thought the patient had a kidney stone. Then the patient was in a lot of pain. And when we did the x-ray to find out the lungs was looking different, then that was a part of COVID. With that being said, patients kept coming on and adding up. And most of us worked 20 hours, 22 hours. And the most difficult time for us was not able to save patients. The reason I'm saying that, as a nurse, I work in the ICU for 31, I'm a nurse for 31 years. Out of the 31 years, I spent 28 years in the ICU. When you go to work, you wanna treat, you wanna heal patients, you wanna have a story. And every time you come to work, we had patients line by line, and then we had to take care of them. Then we started noticing something very interesting. The Black and the Hispanic patients were less likely to survive. Then we started a different approach. When the patients came in, the first thing we did, we ran an A1C. For those of you who don't know what an A1C is, it's a level to find out whether you're diabetic or not. Most of our patients, although they were in their 20s and their 30s, the hemoglobin A1C was 13, 14, 16, 17. They were walking around. And then when we asked family members, do they have any past medical history? Most people say no. But they were diabetic, walking around, young people not knowing. They were asthmatic, suffering from high blood pressure. And we look back, we said, who's your private doctor? Well, we don't have a private doctor. When we're not feeling well, we just go to the emergency room. Then right there, you start looking at healthcare disparities, because these patients that we lost, if they were getting proper medical coverage, if they were diabetic, they went on a proper diet, because some of them were type 2, they could have been on a proper diet. Then with the COVID, which is lethal, they would not end up dying. Then you talk about high blood pressure. Then you look about food. What do you do if you have $50 and you have to go to the doctor? Your co-payment to see a physician is $50 versus buying food for your family. You're gonna go to buy food for your family. When we look in our neighborhood, we don't have a food store. We don't have any healthy food. When you go to the store, if you have $5, you're gonna buy Chinese food. You're gonna get your chicken wings because you get more for your money. Then we start, as a healthcare provider, one of the things with NISNA that we've been talking about is the healthcare disparity. It doesn't only start with seeing your physician, proper nutrition, especially in the underserved neighborhood. If you go to an underserved neighborhood, what do we see? We don't see a food market. We'll see a liquor store. We'll see a lot of fast food. And the fast food, that's what's really killing our community. The children are overweight. And as we know with the COVID-19, if you're overweight, you have high blood pressure, you have asthma, you're diabetic, you're more likely to have complication. So where do we start? We start by saying that we need to have the food banks, but also the food banks need to be able to serve healthier food. We need to be able to help people who cannot afford to buy food to help to distribute in the food bank for the underserved community, because a lot of time the underserved community, when they receive things from the government, it's really unhealthy food. And that's what we feed to our children. And as far as people having the proper care, when we have, I mean, I'm a child of an immigrant myself. When you don't have your papers, people are afraid to go to the doctors because they think if they go to the emergency room, immigration is gonna come for them. So we receive a lot of patients, and when we ask the family, why didn't you bring the person sooner? They'll say, well, they were afraid. And by the time they came in, instead of having a saturation of 97%, the saturation went down to 90, to 50, 60%. We could not even help these patients. And we're talking about people in their 20s, in their 30s, people that never thought they were sick, but they stayed home. And right now we have to know the outreach community. So when I turn on the TV and they're saying, you know what, we lost so many people today, we lost so many people yesterday from COVID, no one is really giving you a breakdown. Yes, if you're older, you are at a disadvantage. But if you're a poor person in a community, especially when you look at the rate, okay, Black and brown people are more likely to die from COVID than any other nationality, any other Asian, white. We are more likely to die. And I'm going to address the vaccine. And unfortunately, we are less likely to take the vaccine. Right now, I'm going around into the community and we're trying to get our community to come out and take the vaccine. A lot of people have reservation, and I said, what are you waiting for? This is, besides social distancing and wearing a mask, the vaccination is what we have to offer. So every one of us in this panel today, I would like for you, everybody who's listening to me, register. I know we're running low on the vaccination, but ask a friend to come with you, take the vaccination. I'm hearing some people are saying the Moderna is better and the Pfizer. They do the same. The difference between the Pfizer, you need a special freezer. So our community is gonna receive the Moderna, which is fine. And your second dose is in 28 days, because this is how we're gonna stop the pandemic. we have to start teaching our community. And we shouldn't be afraid to take the vaccination, because as I told some people, when I took it the first time, I had to put it on Facebook and every chat. But I took it. I'm here. I took the second dose 2 weeks ago, and people call me and say, how do you feel? I said, I feel fine, because I need to be able to be healthy in order to take care of my patients, to take care of my community. But this disparity in the healthcare is what attacking our community, because when you don't have access to proper medical care, when you don't have insurance, when you don't have access to proper diet, when you live in an apartment where the landlord is not able to remove the mold, then you get sick. Your child end up with asthma. Then if you end up with COVID, then you're gonna end up on a respirator. And when you end up on a respirator, it's very difficult to bring you back. Some people do survive, but it's a very few. So the disparity in this country in healthcare is real. And I tell people all the time, I'm fortunate because I work and I'm able to have insurance. But there are times you call a physician, they'll say, well, I'm sorry, I can't take your insurance. It's cash only. I mean, we live in the richest country in the world. And I've had to call a physician and say, I have this patient you need to see. And the first thing they'll say to me, what kind of insurance? Sometimes I said to them, come on, you need to come here. Let's not do that insurance. As a country, I mean, we're supposed to be the leader of the world. When are we gonna have insurance for everybody? To me, every patient is a VIP. Every patient should be treated with the same high quality of care. And as a nurse, as a patient advocate, it's not always so. And then it starts from our local government to have proper insurance. Then we have to go back to federal. When we look at it, to our taxes, I mean, we look at other countries, they are able to provide insurance for their loved ones. And just because you're here without proper documentation doesn't mean you don't have the right to care. Because when I have my patients, I don't ask them questions. I don't ask them what insurance do they have, whether they rich or poor. I care for my patient as they come in. And one of the reasons as a nurse, I'm glad I'm a nurse, I don't do fee for service, meaning I do not get paid per patients. I do get paid, but I have to treat my patients equally and the same. So our appeal is to continue to fight for that single payer, is to continue to fight for Medicare for all. This is the only way we're gonna be able to face this pandemic, because today is COVID, tomorrow could be something else. And right now, I do not believe that we halfway to what we have going on, because we have a surge. The facility where I work, I've seen the surge. Fortunately, we are doing better in how we care for our patients because we learn from the past experience, but people are still coming home and coming in later because they're afraid to come to the hospital because they're not documented. Or there are rumors where people say, well, if I come in the hospital, I'm gonna get worse, which is not true. But we have to see how this COVID, this pandemic is hitting certain community. And then we have to look at the cause, the root cause analysis. That's what we called it in the medical world. It started with
Can't do the community service.
improper patient care.
She is an interest and her mom's an interest.
And also, we have to know how to start caring for each other. With that being said, thank you for having me. And I'll be more than happy to answer any questions in regarding how to get tested for COVID, where to go for your vaccine. Thank you, and it was my pleasure.
Thank you, Nancy. Before we turn to Reverend Jackson, I'm just going to remind everybody about the times so that we do allow everyone to speak and that we do have a time for questions at the end. Reverend Jackson, it's your turn now.
Hello, great to be with you. I'm really grateful for the chance to learn from my fellow panelists as well. Now, I started working for Project Hospitality just 1 month before Superstorm Sandy devastated the island. And all of a sudden, my vocation became very focused on disaster recovery, which was a field that I knew really nothing about as a newbie minister fresh out of the seminary. But there are 3 lessons that I learned from Sandy about the intersection of disaster recovery and human rights that I have seen apply very much to the COVID-19 pandemic. So I'm going to share those 3 lessons. The first one is that people who are struggling due to societal injustices prior to a disaster have the most difficult long-term recovery following a disaster. So Superstorm Sandy was a devastating financial blow to homeowners on Staten Island, but many of those homeowners were able to rebuild because they had homeowners insurance, they could access an SBA loan, or with the vast amount of government resources that went into assisting homeowners through the Build It Back program. Renters, who are more likely to be people of color, and particularly undocumented renters on Staten Island, they lost their housing and their possessions in Superstorm Sandy with few support systems in place to then assist them. In a survey that we conducted with Make the Road New York, it revealed that displaced renters on Staten Island were paying on average $400 more a month in rent for a much smaller space. And we're seeing the same kinds of patterns after COVID-19. So my salaried social service job allowed for me to primarily work from home when the pause on the city was first announced last March. And if I were to contract COVID-19, I would get paid time off through the Family First Cares Act on top of my regularly earned sick time. While many of my undocumented clients were restaurant workers who experienced a total loss of income and employment and aren't eligible for unemployment benefits, other social safety net programs. They didn't receive the first round of stimulus payments, are more likely to be harassed or illegally evicted by their landlord, and have a harder time finding new employment. So people who are vulnerable, not because of personal failures, but because of ageism, racism, xenophobia, and anti-Semitism, and the ways that these isms are embedded in our social institutions will always be most impacted by a natural disaster or a pandemic. Lesson number 2, government response often deepens inequities in disaster response and recovery. So Sandy recovery programs focused on helping homeowners with little support for renters. And now you see the same things. If you're a senior eligible for the COVID-19 vaccine right now, you have to have an email address to be able to book an appointment online, or you can wait on hold for hours on the phone just to hear that there are no available appointments. And if you are homeless or incarcerated in New York City, you are more vulnerable to contracting COVID-19. And certain ethnic and religious groups have been vilified for not complying with Department of Health guidelines, but the city has shared these guidelines primarily in English and through media channels that white residents are more likely to frequent. So that brings us to lesson number 3, that this gap in who recovers after a disaster most quickly is lessened when government works hand in hand with grassroots and nonprofit leaders on the ground. Over the 8 years that I've been involved in disaster recovery, I have seen local government kind of slowly recognize the importance of resourcing local leaders to serve as trusted messengers to their own community members. These trusted messengers can reach their neighbors in far more effective ways than traditional media channels, because we communicate those health guidelines and where to go for financial resources in ways that are culturally appropriate and in the languages spoken by our people, and to the vulnerable communities that we have relationships with. So I serve on the board of a citywide disaster recovery coalition called New York City VOAD. That's Volunteer Organizations Active in Disaster. And this coalition is made up of nonprofit leaders serving in working committees that are actively coordinating around food insecurity, homelessness and housing, emotional and spiritual care, disaster case management, you name it. And I had the Unmet Needs Committee. And so what we do is we periodically conduct a citywide survey to ask nonprofits what they're seeing as the most prominent need in their communities. And lack of food access and rent arrears have consistently been the greatest needs throughout the pandemic. Project Hospitality's food pantry lines have tripled since the beginning of the pandemic. You can see hundreds of people lined up around the block. And we, of course, worried about all of our clients who were unable to leave home to wait online because they needed to quarantine. So when the city created the emergency food assistance program specifically to get food to those vulnerable people, we were able to help our clients sign up to have food delivered right to their home. And through funds that we received from the Mayor's Office of Immigrant Affairs and from private foundations, Project Hospitality has distributed more than $600,000 in direct grants to undocumented families with rent arrears due to the pandemic, preventing homelessness. Let's see, what else have we done? Oh, I'm really proud that Staten Island is the only borough that kept all of our emergency shelter beds open for homeless men and women. And our mental health program receives support to be able to serve people regardless of their immigration status, providing people with Spanish language grieving and bereavement groups. And Health and Hospitals funded PH to develop a COVID-19 prevention outreach team that has given out 300,000 free masks to community members and reached out to Staten Islanders in every zip code and in multiple languages, including Mixteco and Pidgin English. So these are just some positive examples that I wanted to share with you of local government resourcing the on-the-ground people able to outreach the folks most impacted by societal injustices and particularly by the lack of affordable housing in New York City. So there's lots of help available, and I think there's hope. I want to say that there is hope for a more just and equitable recovery from COVID-19 on Staten Island. And the more that we, all of us, all of you on here, are willing to step up as trusted messengers, reaching out to and advocating alongside of our most vulnerable neighbors, then that hope is going to become real for our community. Thank you.
Thank you for all that you're doing. All right, our next speaker is Juan Fernandez. Juan, would you like to take over now?
Yes, thank you to Peace Action of Staten Island for organizing this event. And the first thing I want to say is that, number one, I agree with the assessment of the previous speakers. Here is an exacerbation of the existing inequalities. Access to healthcare, lack of access to food, all of that inequality that existed throughout the world has exacerbated. So the virus is not only feeding, on the people who are sick in the hospital, but they're feeding on this previous lack of access to food and economics, jobs, overcrowding conditions. All of that is part of this. Just let me remind everybody that over 50%, and these are numbers published in the city's website, over 50% of the people who have died of COVID-19 in New York City, are Latinos and African Americans, right? But at the same time, we see our people being left on the street, no employment, no jobs, all right? People, people who are looking for food, and the stock market is soaring. It's over 31,000 points, the Dow Jones. So what is happening here? At the same time as our people are losing our jobs, and women are the most impacted by these losses, services opportunities, people, there's a huge gender gap inequality, and in addition to the race inequality. The wealth of a group of people, 4 or 5 billionaires, have increased over $1.3 trillion, just through September of last year, from March to September of last year. These people have money you cannot even think about. So what is happening here? Where is this money coming from? It's a transfer of wealth. It's a transfer of wealth. The people who are not receiving their paychecks, that money is going into somebody's hand. Those small businesses that are collapsing, that money is going into these people's hand. Amazon's, is making money off the roof out of this, right? For example. So these inequalities are, and the COVID-19 is exacerbated, is creating new gaps of wealth, not only in this country, throughout the world. Remember that during the pandemic, we had a big fights about resources, the big countries confiscating resources, masks for the other countries, equipment for the other countries, ventilator for the other countries. This was the international fighting here, right? That you don't see it in the media, but this was happening here, all right? So that's my thought about this big picture. Yes, I agree with Nancy Haggins. I agree with Karen, but what is happening from a perspective of the New York City Commission on Human Rights? What have we seen in here? We have seen, the first thing we saw at the beginning of last year, March, is an increase on hate crimes. We, during the month of March, April, June, July, August, we saw a huge increase of COVID-19 related hate crimes, crimes mostly against Asians, right? We received about 500 cases, we investigated about 500 cases. What else have we seen there? We have seen increase in the discrimination, employment discrimination, COVID-19 related employment discrimination. There's a perception that somebody was in the hospital, they come back, they lose their job. So we intervene in those cases. We go out there, we work with the person, we try to get those people back into their jobs. Housing, people have been kicked out of their house, their apartments, because there is a perception that these people are infected, therefore they are not allowed to go back to their housing, right? That's another issue. So discrimination, hate crimes, discrimination in employment, discrimination in housing, So, and of course, all of this issue of related COVID-19 discrimination. Our Commission on Human Rights offer protection against discrimination in employment, housing, and public accommodation. We have local jurisdiction, New York City, we operate within the 5 boroughs, but that's what we have been receiving, and that's what we can talk about a little bit later. Thank you, and thank you for your time.
Thank you very much, Juan. Okay, our next speaker is Yasmine. So Yasmine, would you like to take over now?
Yeah, thank you. So my name is Yasmine. I'm a senior a current senior at Stuyvesant High School, and I've been working with the Bell, which is the nonprofit organization that kind of takes lead on Teens Take Charge for about 4 years now. And Teens Take Charge is a youth advocacy group that really argues for integration and equity within New York City public schools. Though we do also concern ourselves with schools that aren't necessarily within the public label, more just increasing the equity amongst New York City schools. And I mostly got involved with Teens Take Charge over the course of last year through the Repeal Hex Calandra campaign, which is the initiative to repeal Hex Calandra, the 1971 act that mandates the use of the specialized high school admissions exam within the specialized high school system. Which because of the racist intent and also impact of the law, and in an effort to kind of hold ourselves accountable, both in terms of legislation and socially, to address the acts such as Hex Calandra, which very much like demonstrates, kind of epitomizes that idea. And as time has gone on, we've started to concern ourselves more with what's going on during COVID and how that's definitely impacted people of different socioeconomic statuses. And there's certainly a power disparity in that regard as well. And so we've taken a kind of pause on Repeal Hex Calandra, though it's kind of been consumed by the admissions committee and campaign as part of Teens Take Charge, though it's never completely lost from our rear view. Right now, we're focusing on the effort to unscreen schools, especially now during the time of COVID, as part of our #IntegrateNow initiative. We're also looking to kind of cancel the administration of the SHSAT during this quarantine period because of the past year. The idea of administering an exam during a pandemic, as well as the absolute economic instability that's kind of been ravaged in New York City, sets it up so that some students are automatically more likely to succeed because if their families have been able to afford the time to study, it just doesn't seem timely that any type of test that would plan for your future like this should be administered, but it still is. And though the DOE claims that it's prioritizing the health and mental stability of its students, actions like this has really angered Teens Take Charge, as well as just New York City public students, to know that not everyone's going to be on equal footing. And so
Theodore said this.
Sorry.
Go ahead. I think it was one of our participants had unmuted. Please, everybody mute yourself so we can hear the speaker. Thanks so much.
Yeah, there is not much more I was going to elaborate on beyond that, but for now, kind of that's what our goals are in terms of looking towards the future. It's continuing that fight, which addressing the disparities within the public school system, but which have been exacerbated due to COVID. Thank you.
Thank you very much. And I'm sorry for how you got interrupted, but you have tremendous poise in the way you kept right on paying attention to what you were talking about. Anyway, thank you. And our next speaker is Emily. Would you like to take over, Emily?
Yes, thank you. Hello, everybody. Thank you for having me today. I am the legal coordinator for La Colmena. We are a nonprofit organization. We advocate for immigrant rights on Staten Island. I want to talk about how we began in the pandemic. We were a very small organization. We had less than 10 staff members at the time. We had just brought in our new executive director, and we were unprepared. I'm pretty sure a lot of it just caught everybody by surprise. And this was a time where everybody just closed their doors on our community, our immigrant community. Our community is one of the most abandoned and like neglected communities. And it was tough because we were a very small organization. We didn't know what we needed to do. So what we did was we started off small. We started off handing out masks, hand sanitizer, allowing our day laborers who stand at the corners looking for jobs on a day-to-day basis. It wasn't a secure job. And at this time, a lot of people didn't even want to pick them up because of to have precaution due to the pandemic. So we had to be there and help our day laborers, our domestic workers. And it was so tough for us as a small organization, but we knew we could not abandon our community. So at this time, we took on the role to help these people who depended on us. Um, they weren't getting any help. They didn't know any resources. Landlords were trying to evict them like unjustly, and they would come to us. We did not even have the proper resources, so we took on upon that role to seek for these resources. How can we help our community? What options do they have? In this time, they were being mistreated. In most cases, families lost the father or the mother, or sometimes even both parents in the house, which were the main source of income. And on top of that, they had to worry about how they were going to survive. How were they going to live? Um, and on top of that, they had to now worry about funeral arrangements. That is also something that we were not prepared for, something that we didn't have the resources for. So we went and we looked for affordable funeral homes, because when you lose a loved one, you don't know what to do next. Where do I turn? Who do I talk to? And especially when this is something even more serious. In most cases, family members had to get cremated. And this was something new to most families, especially in like our culture, in like the community did not even know what were the proper procedures. They were calling us like, oh, some funeral homes had to keep the families outside, like in trailers, and it was just they were scared for their loved ones. Um, so we took on the role to find affordable, um, proper funeral homes, and thanks also to private and multiple private like donations, we were also able to help um, family members on Staten Island. We were able to distribute over $1 million in funds to families throughout, to immigrant families throughout Staten Island, which were not benefiting from the stimulus. And also our food pantry, something that started so small as just masks and hand sanitizers. Now we're able to give clothes, toys. During Christmas, we were able to give toys to the kids, which parents were not able to afford in this time. We were able to give hand sanitizers, masks on a daily basis. Every week, we're able to give food and resources. People have been donating clothes. That is something that we are able to do now. We have grown as an organization, and it's great that we're able to help the community, which they now know us, and now they know that they can rely on us. And it's good that we are able to form that communication with our community so that they can feel like they're not being abandoned. We are here for them. And hopefully we are able to keep providing these resources for them, and we're able to give them more help, as a lot of them are still going through the rental issue. A lot of them are still having problems paying their rent, as some of them still aren't able to work. And in most cases, a lot of our community is testing positive now. So a lot of them are actually even losing their jobs, even if they're already past the even if they're already testing negative after they had tested positive, because now their bosses don't even want them to come back to work. So that's another issue that we're seeing, and we're trying to find ways in which we can help. As well as we were able to previously do in-person events, and now we cannot. So that's something also that throughout the pandemic, we were doing a series of Facebook Live events every Friday with new resources, rental assistance, legal assistance. In the beginning of the pandemic, there were still ICE raids going on. That is something else that we were, know your rights. Now we are able to provide a space for mobile COVID testing in front of our office. So now we're able to have doctors on our Facebook Live speaking of updates on the vaccine, COVID testing, how to stay safe. These are things that we nonstop, as a small organization, we were able to keep working and bring these resources to our community. In most cases, we didn't even know who to speak to anymore. And now this is something that we are able to bring to them, just like some hope. We worked endless hours just to try and show them that they're not alone, that they have options, and we're bringing them these options. So I want to thank everybody else here with their efforts in helping the community as well, because I know we couldn't have done this alone, and this is thanks to everybody else. The other panelists I know have mentioned their efforts as well, and I want to thank everybody else. Thank you.
Thank you very much. I would now like to ask Peter, are you available to speak now?
I am. Thank you, Barbara. And if I could be made a co-host to share my screen, that would be great. But before I'm able to do that, let me just quickly, I was invited to talk about housing rights, but I want to quickly mention what my organization is doing in response to the crisis and the services that we may be able to provide to some of you and also the clients of your organizations. We have for decades done wills and other advance directives for low-income seniors, and that is more important now than ever because they are really vulnerable to COVID-19, and to have the right plan in place and to be able to empower your loved ones in case you become incapacitated or if you pass away is extremely important. We've also extended that service to provide those documents to frontline and healthcare workers, regardless of income during the pandemic. And so if folks work on the front lines, work in the healthcare industry, and are concerned about their own safety and want to have their documents in place, that is something that we're doing as well. We also have a micro enterprise project that helps small businesses with a particular focus on commercial leasing issues. And we know so many small businesses have lost income during the crisis, have fallen behind on the rent themselves, and are having issues with their landlords. And finally, I'll mention that we have an unemployed workers project where we assist workers who have lost their jobs due to the COVID-19 crisis, and with applications for unemployment insurance and representation at hearings. But shifting gears to talk about housing, and I know so many of my fellow panelists have mentioned the issue of housing today. So many New Yorkers who have lost employment due to the crisis now find themselves at risk of eviction. And there have been a number of eviction moratoriums that have been put in place since the start of the pandemic. The most recent one was signed by the governor in late December. This one prevents landlords from starting an eviction case unless they could show that the tenant hasn't experienced financial hardship due to the pandemic. And so they must first give tenants a hardship declaration form to fill out. And if a tenant fills that out, then the landlord cannot start an eviction proceeding until May 1st. And for those people where there's already an eviction proceeding taking place, they also have to have the opportunity to be able to fill out this financial hardship form and return that to the court. And if they do so, that will push back any current pending case until after May 1st as well. It also has some protections for folks who may already have judgments against them, where the case has been going on for some time and there's a warrant of eviction. Those judgments can be undone with the help of this new law. The one important thing I think to point out about this, unfortunately though, is that this is not rent relief. This simply kicks the can down the road for tenants who have been unable to pay their rent. And so, yes, it is a good thing. We would much rather somebody be forced to deal with an eviction proceeding in the spring and in the summer than in the midst of this pandemic winter. But in the end, there needs to be something done about rent relief so that people are able to stay in their homes when this crisis passes or when it at least subsides. So let's talk about what this hardship form says and who would qualify. So clearly somebody who lost income during the pandemic, somebody who had increased out-of-pocket expenses, maybe because they were an essential worker, or they had health impacts, childcare impacts, caring for sick or disabled family members during the pandemic. You could also show that if you're unable to afford to move or can't find alternative housing, then you would qualify for this hardship exception. And also really other circumstances related to the pandemic that may have negatively affected you. You could check that box and say to the court, look, this should be put off until May because of these circumstances related to the pandemic. Then there's another catch-all. If somebody in the household is over the age of 65, if they're disabled, or if they have any other underlying medical condition, cases should also be postponed until May. But it's important that people fill out this form. And so if a landlord is serving somebody with court papers, and if they send that hardship declaration to a tenant, the tenant should not ignore that. Because it's like a tree falling in the woods. If nobody could hear you, does it make a sound? And so people really need to speak up in order to get these protections. Like I had mentioned before, there's been these earlier protections, the Safe Harbor Act, Cuomo's executive orders, the CDC moratorium. But right now, the strongest protections in place are this New York State moratorium that passed in December and goes through May. One of the things that we have seen certainly in the pandemic is, landlords, if they're unable to collect rent, they're trying to retaliate against tenants to try to harass them out of their housing. And so this often takes the form of failing to make repairs, failing to provide essential services to tenants. And the good news with this pause in housing court proceedings is that tenants are still able to take landlords to court to enforce their right to safe and habitable conditions. And so tenants are able to bring what are called housing cart or HP cases to force landlords to make repairs in their apartments, and those are still ongoing. The other thing that the moratorium also puts a pause on is utility shutoffs for tenants. So many of the somebody seemed to mute me, but as I was saying, as part of the eviction moratorium, there's also a utility shutoff moratorium. And that's also through the end of March. And if you suffered financial harm due to the pandemic, your essential services, your lights, your water, your heat cannot be turned off for non-payment. And there are grants available for people who have fallen behind on utilities through the Home Energy Assistance Program, also known as HEAP. In the interest of time, I'm going to skip through kind of the housing court cases because they're not going on right now. But like I said before, landlords are still sending court papers, they're still sending notices to tenants, and it's very important that tenants do not ignore those. And I want to give a really great resource that's out there for tenants, which is Housing Court Answers. Even for there's a lot of things that have moved online, and other speakers have mentioned that many low-income people don't have internet access, and particularly seniors don't have that access or don't have that comfort with technology. And so they run a hotline to be able to help folks through the crisis, and that's up on the screen. Landlords, beyond not making repairs, are also engaging in harassment to try to force tenants out, making threats, locking people out, stealing or damaging property, sending notices, not making repairs. Tenant harassment is illegal in New York. And you could also bring HP cases that will address the issue of harassment in addition to the issue of repairs. And so, folks should not be scared out of their apartments by their landlord due to harassment. Because right now, landlords' hands are tied with respect to eviction proceedings. So they're really taking these kind of extrajudicial steps in order to try to force their tenants out. One thing to note, and I'm glad some of these speakers have mentioned undocumented New Yorkers through this. A lot of undocumented folks are scared to go to courts in order to protect their rights. And what, undocumented tenants have the same rights as other tenants. They are not allowed to be harassed and retaliated against by their landlords. And Juan, who was on before from the New York City Human Rights Commission, this is under his purview, but that is a violation of the New York City human rights law. And I would encourage anybody who is an immigrant or being discriminated against in any way by their landlord because of their race, their religion, their immigration status, their source of income, whatever it is, to contact the New York City Human Rights Commission to get some assistance from those great folks. There are some COVID-19 related rent relief programs that are out there. They are unfortunately limited in scope and limited in time, but I would encourage people to try to take advantage of them. The most recent program, which is specifically COVID related, the application deadline actually closes in about a week. My hope is that the folks down in Washington will infuse more money into these programs, will extend eligibility, will extend the time to apply. But right now, that's the current program that was run by the New York City Housing and Community Renewal Department. And so folks are able to apply for that. And the New York City Human Resources Administration is still processing applications for what are called one-shot deals, which are one-time grants for people who can show a future ability to pay, but have fallen behind on their arrears. Because like I said earlier, all of these protections that are in place are just kicking the can down the road. And eventually these tenants are going to have to pay unless there's real rent relief that happens either in Albany or Washington. And so if people could get a handle on arrears that have accrued during this pandemic, then that gives them the best chances for staying in their housing in the long term. So I'll stop sharing there now and turn it over to the next speaker. Thank you for having me.
Thank you for all that information. We are now going to go to our last speaker, who is Tanuja. Tanuja, are you ready to speak?
I'm ready to start. Thank you very much.
Thank you.
Hi, everybody. My name is Tanuja Mohapatra. I'm part of the Department of Financial Services. So let me give you a little background about what the Department of Financial Services is. It's actually, we are the primary regulator at the state level for banks and for insurance. And so for that purpose, let me just separate it out. We are the primary regulator for insurance. Insurance is regulated at state levels. So when I say insurance, let me break it out even further for everybody to understand. So if you have Medicare, that would be at the federal level. And if you have questions, you should speak to that. If you have Medicaid, that is a state, but it's DOH. So what we do is we regulate the commercial market. So the majority of people receive their insurance from an employer. If you have questions about insurance during COVID or what in your insurance coverage is, the number that's going to be shared, you can also call that number for any insurance questions. We do have a consumer assistance unit staff. They will assist you in understanding your insurance and coverage. On the banking side, we actually are the primary regulator for state regulated banks and state entities. So those are our entities that get licenses with the state. So that's like a check casher, money transmitters, and also state chartered banks and state chartered credit unions. As many of you know, there's actually federal banks, and those are regulated at the federal level. I think it's quite fitting that I go after Peter. Peter just spoke about tenant rights. I'm actually going to talk about if you own your home and what are your rights under state law for mortgages due to COVID. So there are a couple of different laws and things that have happened at the state level that may be confusing. The first thing that I'm going to talk about is when COVID hit, the governor along with the Department of Financial Services worked together to do, in his executive order was basically mortgage relief. And so what that was called was mortgage forbearance. What you were able to do is call your bank, so that's whoever you pay your mortgage to, and speak with them to talk about you were experiencing hardship during COVID. And that is still going on today. It's actually been extended into law. So you get 180 days. And then if you are actually still experiencing COVID hardship, you get an extra 180 days. So practically, what does that mean? That means that you should speak to your bank servicer. So whoever you write your mortgage to, you give them a call. First, you want to know, and they'll let you know if you're qualified for state level help or if there's federal programs. If you go to our website or if you call the 1-800 number, we can also help you figure out if you are state regulated or if it's federal. And on our website, we do have listing of the federal programs. So at the state regulated, when you say COVID and what is hardship, while each entity has a different guidance for what that is, everyone is looking for certain things. So what I would say, it would be a loss of household income. It would be a significant decrease of work if you're self-employed. If it's childcare responsibilities, moving would be difficult. And usually you can show an unemployment check or that you have a loss of income, those types of things to provide proof. But the best thing to do is to work with your servicer. And so what the options are is that you could actually, depending what is best for your financial portfolio, you may have a couple of options. One is you could put the total amount at the end of your loan and do a balloon payment, or you may want to divide it up amongst the different loans or different, mortgage payments, depending on your scenario and your situation. The biggest thing to know is that there's a difference between forbearance and foreclosure, and they have very different effects. So forbearance is at a point where you are still paying your mortgage payments, but you're getting to a point where you can't make those payments at that amount. And so this is when you need to make a phone call to your servicer. Obviously, you can also give us a call and we can help you figure out exactly who to speak to. Foreclosure is actually a legal proceeding. So at this point, you have missed several payments and now you're into a legal proceeding. And so now it was the same law that Peter spoke about in December that was signed by the governor that has put a stay on foreclosure for COVID hardship. And there is an actual hardship form on the Office of Court Administration website. If you go to our website or you give us a call, well, hopefully we can help you navigate that so you can get that form. So that form, technically, all you need to do at this point is fill out your name, fill out some information. It does not need to be notarized and either sent back to the court or sent to the servicer. We always recommend that people do both if you're self-representing. If you do actually have a housing court lawyer, they can obviously help you too. So please note, while you don't have to provide evidence, you are signing it under perjury. So at some point you will have to provide evidence. So they're two separate ideas. Now, I think the hardest thing is that when you own a home is that it is part of who you are. And it's one of the most difficult things to talk about with people. We find that many people don't ever talk about if they're experiencing financial troubles paying their mortgage payments, because what they do is they take a very big pride in your home. So that's why we're urging everyone to start having those conversations with their servicer, or please feel free to give us a call so we can start that conversations. Those conversations are completely confidential, and we will help you speak with your servicer. Now, in that conversation with your servicer, or if you are speaking to the person you pay your mortgage, if you're not getting the information you need, don't feel lost, give us a call. Part of what the department is supposed to do is work with our state regulated entities to make sure that they're helping consumers understand what are their options. And during COVID, this particular superintendent has taken a direct interest in that. We actually call this regulated entity if we get complaints, and if we get a significant number of complaints of consumers not understanding what their options are, we talk to the management, we talk to the heads, and make sure that there's clarity that comes down. We don't want any consumer or homeowner, after getting off the phone with the servicer, feel even more lost or even more hopeless about what should they be doing if it's not clear. And so what I urge everybody to do, again, if you are a homeowner and you are facing hardship, to please give us a call so we can at least have that initial conversation with you. At this point, I'm just going to turn over my time because I think there are a lot of people who have questions, and maybe that would be, a better use of the time, and I'm happy to answer any questions.
Thank you very much. I actually want to thank all of the speakers. You've provided tremendous information to all the participants, and we're all very grateful that you took the time to participate today. So now I would like to ask anyone who has a question to please put it into Zoom, and we